I'm Federica Bellingieri, I'm Patient Centricity Manager.
I'm Natasha Stryker, I'm OSA Business Development Manager.
I'm Bao Becker, I'm OSA Account Manager and Product Specialist.
And I am Francisca Karel, Patient Care Manager OSA.
We are a team from AirLiquide Healthcare Netherlands. We are enthusiastic to present you Quality of Life Booster Program, the first value-based healthcare initiative we implemented for people with obstructive sleep apnea, what we call OSA. The Quality of Life Booster Program aims to introduce the concept of adherence to the treatment to improve quality of life of people suffering with OSA by placing them at the center of the therapy and by using personalized care plans and motivational training programs. OSA is a respiratory disorder with an estimated prevalence of 5% worldwide and that increases with age. It is often associated with one or more comorbidities, especially cardiovascular. It induces drowsiness and could cause road accidents, for instance, and impacts patient mental health. The treatment for OSA is CPAP, continuous positive airway pressure. Adherence to the treatment is essential to obtain long-term clinical benefits.
In the Netherlands, in 2021, there have been reported 280,000 people with OSA, with a yearly growth of plus 9% over the past 5 years. For this, OSA is becoming a burden for the Dutch healthcare system. Quality of Life Booster Program started with 35,000 people suffering from OSA. We have asked them what are the outcomes that matters to them, and reflecting their perception of quality of life. This allowed us to identify valuable patient outcomes to be measured in the objective to transform our current compliance to treatment model into an outcomes-driven model. The new model is built on four pillars: stratification of patients, evaluation and motivational interviews, educational training program, and flexible personalized care plans.
During the first visit, a nurse from AirLiquide Healthcare educates the patient in therapy, determines his profile, and predicts the adherence to the therapy, high, moderate, or low, via a motivational interview and 13-question survey. The stratification approach allows to assign a flexible care plan for each patient. During the patient's pathway, the nurse has several contacts with the patient via different channels, like visits, calls, emails, or telemonitoring. The initial phase of the therapy is key for the future adherence. For this, the frequency of the contacts is higher in the beginning to ensure engagement of the patient. Once the patient has been engaged, we can follow remotely at reduced frequency. In each contact moment, outcomes are measured and segmentation is performed. If the patient changes profile, we assign a new care plan, more adapted to the new condition.
The Quality of Life Booster Program has been designed by a multidisciplinary and an international team of nurses, psychologists and data scientists, and last but not least, patients and doctors. It has been implemented in 2021 in collaboration with 4 hospitals with a total of 140 patients, followed by 8 nurses. And the results are excellent. Patients' quality of life increases for all the patients during the first 3 months of the therapy, as well as the adherence to the therapy. Supported by these results and by the digital transformation of our operations, which introduce innovative and cost-effective digital channels, we will scale up the model to all our new OSA patients.
With a long-term vision, the program will change our company to enable best quality of life for our patients and contribute to the healthcare system sustainability.
Take care with you.